Hi, good evening. I am Dr. Gopal Krishnan. We will talk about the chronic cough. What are the causes for the chronic cough? Chronic cough, respiratory causes, GAD causes, cardiovascular causes, or drug induced. Respiratory causes, what you will think? First cause we will think about the post-nasal drip. Then second cause, what you will think about? Interstitial lung disease. Okay. Then other things, bronchiectasis. Then CA lung. Okay. Then what are the other GAD causes like gastroesophageal reflux disorders, GERD or achalasia cardia. Okay. Then drug-induced statins, ACE inhibitors, AR inhibitors, and immunosuppressants like interferons. Okay. Then cardiovascular, enlargement of left atrium compressing the recurrent laryngeal nerve causing cough. Okay. So these are the chronic cough. If a patient presented with a chronic dry cough, what do you have to look for in respiratory causes? So you have to look for the hands, like you see the clubbing. Next, you see the crackles. If you get all the threes like cough, clubbing, crackles, if you get all the three, you have to think about three main causes. CFA, cryptogenic fibrosing alveolitis, that is called IPF, idiopathic pulmonary fibrosis. CFA, okay. CF, cystic fibrosis, that means what? Bronchiectasis. Then CFA, CA lung. So CFA, cryptogenic fibrosing alveolitis, CF, cystic fibrosis, bronchiectasis, CA lung. These are the main causes. So chronic cough, clubbing, crackles. Don't forget it. 3C is equal to CFA. Thank you so much.